Definition: to ensure that you are administering the procedure to the right client. Purposes: determine the number of fetus, identify the presentation, position, degree of descent, and attitude of the fetus, identify the point of maximum intensity of fetal heart tone in relation to the woman's Check the client's chart. Read the doctor's order for the said procedure, condition of the client, and restriction. Rationale: to ensure that you're administering the procedure to the right client. Do the client assessment, obtain obstetrical history including the AOG, EMP, and the EDC, and the LMP. Also take the fundic height as well as take the vital signs. So ma'am, kapila na ka nabuntis po?
First time pa lang.
Okay po. So, how about pila na ka months imuhang ano po?
7 months.
7. Ma'am, niagi kag abortion?
Wala.
Wala. So, when po imuhang first day of last menstruation?
April 5.
April 5, 2021. Okay, thank you. So now we're going to start to measure the fundic height. So with the use of this measurement, tape measure. So ma'am, I'm going to measure your fundic height po. Itaas na po natin siya para makuha po natin yung dalatang sukat. So by measuring the fundic height, we start here at the symphysis pubic up to the fundus. Okay, from here. Okay, 34. So now we're going to take the vital signs of the client. Okay, ma'am? Pupunan na po kita ng vital signs ko. Try to relax. Okay, 120/80 po. Normal naman po yung vital signs natin. Okay, tatanggalin ko na po siya. Okay. Rationale: to gather data would make computation accurate. Explain the procedure to the client. Okay, hi ma'am. I am Quinzel Limbuan. I am your student nurse for today. So, I am going to do the Leopold's maneuvers. So, in this procedure, I am going to determine the fetal presentation and the fetal position by palpitating the gravid abdomen. So, I am going to palpitate or touch your womb to determine the fetal presentation and the fetal position of your baby inside your womb po.
Rationale, to elicit cooperation of the client. It reduces apprehension and encourages cooperation.
Instruct the client to empty her bladder before performing the procedure. Okay, ma'am. So, before tayo magsugod, basin gusto ka mangingisa. Kung kayon ka, okay lang po.
Di lang, ma'am. Kukayon.
Okay po. Sige, okay, magsugod na taka.
Rationale, to avoid discomfort to the client and provide relaxation during the procedure.
Gather the needed equipment and check for its completeness. So, we have here the measurement, the tape measure, the cuff, and this stethoscope as well as the pillow.
Rationale, to be organized promotes efficient time management.
Do hand washing prior to the procedure.
Rationale, to do hand washing deters the spread of pathogens.
Provide for the client privacy.
Rationale, to ensure cooperation of the client during the procedure.
We're going to place our client into a recumbent position. Okay, ma'am. Or supine position. Pwede po maglingkod lang po. Okay lang. Sige po, ganyan. Tapos, spread, provide a cover for the client as well as expose only the wound for our procedure. So,
Rationale, to have easy access during the maneuver to make client more comfortable and gain cooperation.
make sure that our hands are warm before coming intact into our client's abdomen. So we're going to rub our hands to warm it.
Rationale, to prevent startling the client to produce warmth.
First maneuver, fondal grip.
Using both hands and facing the client, feel for the fetal part lying in the fundus, determine the shape, size, mobility, and consistency of what is being palpated. Findings: head is more firm, hard, and round that moves independently of the body. Breech is less well-defined that moves only in conjunction with the body. Rationale, to avoid overreaching of the client's abdomen and able to palpate the fundus and feel the parts lying under. Second maneuver, umbilical grip. One hand is used to steady the uterus on one side of the abdomen, while the other hand moves slightly on a circular motion from top field for the fetal back and small fetal part. Use gently but deep pressure. Repeat this step from the opposite side using opposite hands. Findings: fetal back is smooth, hard, and resistant surface. Knees and elbows of fetus filled with a number of angular nodulation. Rationale, to use both hands in palpating aid in correct findings during the second maneuver.
Third maneuver, pollex grip.
Using thumb and finger grasp the lower portion of the abdomen above symphysis pubis, press in slightly and move gently movements from side to side. Rationale, the usage of thumb and finger would help in the determination of a presenting part either engaged or not engaged yet.
Fourth maneuver, pelvic grip.
Use both hands facing foot part of the woman, palpate fetal head, pressing downward about 2 inches above the inguinal ligament. Findings: good attitude is brow correspond to the side that contain the elbows and knees. Poor attitude is revealing that fingers that meet obstruction on the same side as fetal back. Rationale, to avoid overreaching of the woman's abdomen.
Place client to its comfortable and proper position.
Rationale, to make client relax after the procedure.
Do hand washing. Wash hands.
Rationale, to reduce transmission of microorganisms.
Document the procedure and assessment during the care.
Rationale, a careful record is important for documentation after client care. Reporting and recording of information about the procedure must be accurate and timely for continuity of care. Thank you and God bless us all.